did the doctor send you? Whoa, you're eye candy. That was a statement made by a man waking up from anesthesia and seeing his wife. Have you ever heard a funny story such as that one and wondered, what is anesthesia and why does it affect people like this? Well, if you have ever experienced anesthesia, you may have a funny story like the one I just mentioned. But if not, you may want to know what might happen if you ever find yourself in need of anesthesia. Although I'm not a CRNA or an anesthesiologist, I have myself experienced anesthesia 5 different times. And although none of my experiences are quite as funny as the one I just mentioned, I do feel I have a pretty good understanding of what anesthesia is and how it affects the body. This understanding is what drives me to further my education in pursuit of becoming a CRNA. Anesthesia is one of the most important medicines used today in assisting with pain-free medical procedures. Today I'm going to cover what anesthesia is, what different types of anesthesia there are, some of the complications from anesthesia. So let's start with what anesthesia is. Anesthesia is a way to control pain during an operation or procedure by using a medication called anesthetics. Designed to make you feel comfortable, it is used to help relax you, block your pain, and make you sleepy or forgetful. For major surgeries, anesthesias would be used to knock you completely unconscious. This would be used during an open heart surgery, brain surgery, or a traumatic trauma surgery. Anesthesia is used to help control your breathing, your blood pressure, blood flow, heart rate, and rhythm. Now for my second point. Let's discuss what types of anesthesia there are. There are 3 main types of anesthesia used today for medicine. First one is a local anesthesia. Local is used for a small part of the body or region. Like getting a shot of Novocaine when you're at the dentist about to get a cavity filled. This would numb just that small area. Then there's regional anesthetic. Regional anesthesia is used to block pain around a specific nerve, or it is injected into the spinal cord to block pain from an entire region, like the lower region of your body. This you would find in a woman who's in labor getting an epidural. Then there's general anesthesia. General anesthesia is used to affect your brain and the rest of your body. This type of anesthesia is used to knock you completely unconscious and make you unable to feel any pain during a surgery. And finally, allow me to move on to some of the fun facts of anesthesia, talking about the side effects. It seems like there are always complications with any medicine, and anesthesia is one of the medications that carries some risks. With any healthy individual, the risks and side effects of anesthesia are greatly reduced. However, some of the complications of anesthesia are temporary mental confusion, lung infections, stroke, heart attack, and death. One of the funny side effects of anesthesia is temporary mental confusion, which leads people to say often very funny things. The most likely cause of this is a drug called sodium thiopental, or truth serum. However, the exact reasons are still really unknown. One scary and interesting side effect of anesthesia would be waking up during a procedure. This only happens in 1 in 1,000 surgeries. However, the patient usually does not feel any pain at all and is simply aware of their surroundings. However, sometimes a patient does wake up and does feel pain. This is extremely rare and usually only happens during a trauma surgery. The patient most likely wakes up feeling pain but is unable to communicate that they feel pain due to being given muscle relaxers prior to the procedure, which is also a part of receiving anesthesia. So now let's wrap it up. Anesthesia is one of the most important medicines used today, helping ease and control pain from mild outpatient procedures to intensive emergency surgeries. Having a trained anesthesiologist to properly monitor and give the correct dosage of anesthesia is extremely important. This is to ensure that there are mild or no complications during your surgery, because, hey, nobody wants to wake up in the middle of a surgery. And even though many of the side effects of anesthesia are unexplained, some of the funny ones, like waking up and telling your spouse how hot they are, anesthesia seems to be the only medication that has these funny complications. So I hope you have learned what anesthesia is, the different types of anesthesia, and some complications that arise when under the influence of anesthesia. Because who knows, maybe one day you'll find yourself under the knife and in need of anesthesia.